Episode 10, Youth Mental Health Activities. 3 days of workshops, 4 hours each day, and I think maybe 6 activities. How did you pull off 12 hours of mental health workshops? What would keep youth that engaged? They actually asked for it. While we were working on our website, the topic of youth mental health kept coming up because their friends and people they care about were feeling depressed. We put together a series of workshops to answer their questions. It was actually written and developed and co-facilitated with some of the members of the movement. So it's movement for movement kind of. The first activity I'm going to talk about is called Post-it Battle, or maybe categories, depending on how you feel. We wanted to talk about the symptoms, causes, and treatments for depression and anxiety. It's a lot of information, but we didn't want to just talk at the group. We wanted it to be more fun and more organic, so we turned it into a game where we would split the group into two, and they would have to come up with as many different symptoms, as many different causes, and as many different treatments as they could. We set like a time limit for each category, like 10 minutes to search and to write down your answers. You put each individual answer on a different post-it note, and the team with the most unique answers wins. The team with the most unique correct answers. After we tally up all of the points, we have to go through to see who was right and who wasn't. For symptoms, we mean what does it look like? What does it feel like? What are the thoughts? What are the warning signs? For causes, we mean what are the stressors? What are the risk factors? Things like that. And for treatments, we want to look at where can we go for help and what can we do to feel better. And then the points round, we compare all the answers on post-it notes, and the most correct, unique answers win. Why this works? It's not a lecture. It's an activity where you can work in groups and use the internet, use your phones. It's fun. Another reason this works is because it encourages youth to start doing a bit of their own research, showing them that they can get some answers to some questions. Because each team has to go through all their answers and we have to compare answers, what ends up happening is everyone ends up hearing the right answers multiple times. It's a great game. It allows you to research, to learn, to talk about some of these issues. Just make sure it doesn't go over an hour. If it goes over an hour, it's gone on too long. The second game is another variation of our great debate. For this topic, we use Can You Save People? For the particulars of the rules, check out our great debate video. I wanted to talk about what it means to support and how we can support our friends and what we can and can't do and when is a good time to refer. So turning it into a competitive debate really allowed us to dig into the heart of the issue. Can you save someone? So we use talking about other people as a way to talk about ourselves. Can you save other people is also about, who can save who. We had a really great debate on this topic. It became very clear as to what the right answer was in a way. So physically, you can save a life, like with CPR, or physically you can. But physically intervening can also be dangerous, like with bullies or fights or fires. When it comes to the mind, you can't make choices for other people. But what we can do is be a good friend. And we can also refer people to supports, counselors, and programs that are good and helpful. So that's where the knowledge about knowing about the symptoms and the warning signs and the treatments come in. So understanding what you can do and what you can't do and knowing when to do what really makes people feel more powerful. The next activity was actually the first activity. We call it Wall Words. It's a chance for us to really set the tone for the day. First thing we do is we ask a question, like, how are your friends feeling these days? Or, what specific problem do you hope to learn how to solve? The goal for this activity is to get everybody on the same page energetically because we have similar concerns and similar desires for the program. So after people have written down their answers, they post all the answers on the wall. And then people are supposed to take an answer that they didn't write, somebody else's answer, and speak to it. And then we go around the room and everybody says, I think the person who wrote this meant, and then they explain it. It's always easier to talk about other people's feelings. So we created an activity where people can speak to other people's feelings knowing that we're all connected. Everybody gets to be heard in this activity, and nobody gets to feel as if they're being singled out or whatever. This also acts as a form of feedback, so we know what our people are expecting and what their friends are going through, helping us to know how to respond. The next activity is called case studies. We wanted people to get a little bit of a taste of how the CBT thinking process works. So before the sessions, myself and some youth wrote some stories about some mental health related challenges that youth could be going through. We did the stories to each group and asked them to identify the thoughts that the characters were having or could have, some of the feelings that these characters would be having and feeling, and so some actions that they were having or behaviors. So we approached it from the model of the ABCD approach. You can check that out on your own. We asked each group to think critically about the case study, to think about which thoughts or ideas or feelings are causing the person distress. After each group had broken it down into some actions and thoughts and feelings, we asked them to come up with some SMART goals for each character to help them move forward. Each group was given a different story, and when they were done, they were asked to present their story and their findings and their goals to the group, and we discussed. Since the topic of depression was coming up so often, we wanted to talk a little bit about gratitude. So we made up something we call gratitude bingo. It's basically bingo, except the 25 answers that you get are based on things that you're grateful for, you know? We'll post the specific questions that we used, but you can make up your own as well. And these are the techniques that the movement used to teach difficult ideas. We try to make sure it's as safe as possible while empowering youth to help come up with solutions to their own problems.